Hi, my name is Jehng, and today I'll be educating you guys on diphtheria. Now, did you know that nowadays 1/10 of the people who contract diphtheria die? So let's say everyone in this room has diphtheria. That means of all of us 60-ish people, 5 to 6 of us will die. So let's flash back to the 1700s, and let's say all of us have diphtheria again. But this time, there's no vaccines, no antibiotics, no antitoxins, and there is no prevention. So that would mean about 80% of us would die, so 48%. And back in 1901 in St. Louis, 10 out of 11 inoculated kids in the St. Louis Medical Hospital died from diphtheria, which is a 91% mortality rate. Now, here's a story that some of you may know. So back in 1925, the Great Race for Mercy happened in Alaska. What happened was, in Alaska, there was an epidemic of diphtheria, and what happened was the Alaskan children and Eskimos were with horizontal transmission. Diphtheria was being transmitted between the people there. And so up there, Curtis Welch and 4 nurses were the only physicians and doctors in the Nome area. So what had to happen was Curtis Welch sent a telegram to Anchorage and asked for shipments of diphtheria antitoxins to be shipped to Nome. But there was a catch to that because Anchorage had to transfer it by train to Nenana, and from Nenana to Nome, it had to be transferred 674 miles by dog sled to Nome. And then the thing for Welch was that all his antitoxins have expired, so thus if he gave it to the kids, it could have potentially killed them and caused even more casualties. And the race against time and the journey transfixed the country, and awareness and publicity of diphtheria was spread across the country as people followed the dog sleds as they crossed Alaska. And today I'll be talking to you about the introduction, history, definition, symptoms, demographics, risk factors, type of diphtheria, transmission, prevention, cure, diagnostic, experiment, and conclusion. Introduction. Diphtheria has been around for 2,500 years, and it has been first recorded 500 BC by the Greeks. Diphtheria is leather in Greek, and is known as that for the leather pseudomembrane that covers the throat and tonsil of an infected person's respiratory system. There are various cold-like symptoms for diphtheria, and there are many of them and have a wide range. For diphtheria, it infects people of all ages, and especially those that are immunocompromised and old and young. Diphtheria has 2 types, respiratory and cutaneous, or skin. It is acute, which means that it's short, but it develops quickly, and communicable, which means that it is transferred from person to person and is contagious. Nowadays, there are cures and vaccines that have been developed for diphtheria, and there are so thus making fewer outbreaks. There is a lower mortality rate, and it's spread through horizontal transmission, which is person to person. Now onto the history. So it was discovered in 1826 by a French physician named Pierre Fontenot. The first epidemic was in Spain in 1613. In Spain's history, the year 1613 is known as El Año de Garritos, which means the year of strangulations. And it is known as that because many Spanish people died from diphtheria, and they died mainly from choking from the thick gray pseudomembrane that would cover their neck. Although mortality rates are unknown for that epidemic, many Spanish cities were wiped out. 80% of infected children under 15 died during the 1700s, and any time before the 1700s, before the vaccine and cure was developed. Ellen Klebs and Friedrich Loeffler were German physicians who first discovered the bacterium behind diphtheria, Corynebacterium diphtheria. They named it the Kleb-Loeffler bacterium. Loeffler was the first to cultivate the bacterium responsible for diphtheria. He also proved that Corynebacterium causes exotoxin, and an exotoxin is basically what a bacteria releases, and it is toxin that could cause blood poisoning, which is also another cause of diphtheria death. And then the definition of diphtheria. Diphtheria is an acute, highly contagious bacterial disease. It is inflammation of the mucosal membrane, and nowadays it is rare in developed countries because of widespread immunization and awareness. It causes death by sickness, choking from the pseudomembrane, or blood poisoning by the exotoxins released by diphtheria. Symptoms. Diphtheria has many symptoms, and there are various in cold life. Symptoms include swelling lymph nodes, fever above 100.4 degrees Celsius, rapid bleeding, bull neck, which is basically what happens when the neck becomes inflamed. The neck expands and swells, and the skin becomes leathery. Swelling, ulcers, and bluish skin, and that happens all around the body for cutaneous diphtheria. Sore throat and difficulty swallowing, coughing, malaise, hoarseness, a thick gray membrane coating the pseudomembrane coating the neck and tonsils of the person, redness, burning pain, and blood-stained nasal discharge, cardiac arrhythmias or irregular heartbeat, myocarditis or an inflamed heart, and cranial and peripheral palsy. Demographics. The demographics of diphtheria The demographics of diphtheria include the elderly, the young, the unvaccinated, travelers who travel to recent places where diphtheria is an epidemic, or people who live with other infected people. Risk factors include people who live in tropical climates, live on the equator, third world countries, unhygienic and unsanitary people, and people without vaccines. Types of diphtheria. There are two main types of diphtheria, and they are respiratory and cutaneous. Death occurs in 5 to 10% in respiratory and 20% among children under 15. Cutaneous is more common along the tropical region and equator, and is more contagious than the respiratory, and it causes severe skin infection and ulcers across the whole body. Transmission. Diphtheria is transmitted through horizontal transmission, and there are 3 methods through which it transfers: person to person, airborne, or contaminated item to person. Transmission from person to person includes bodily fluids, touching each other, sexual contact, sharing clothes, or eating together. Airborne include breathing, talking, laughing, and sneezing. For contaminated item to person, it could include diphtheria bacteria living in the ground or on the surface of an item, and the person with an open cut or wound or orifice touches the contaminated item, and the diphtheria bacteria is transferred from the contaminated item to the person. Prevention and cure. Prevention methods include good hygiene, staying home, immunization, and drinking fluids to recover, while vaccines include DTaP and booster shots and Quinvaccine. Quinvaccine is a pentavalent vaccine which is meant that it could be used to treat diphtheria and 4 other virus diseases. DTaP is a 3-for-1 vaccine, and it's used for diphtheria, tetanus or lockjaw, pertussis, or whooping cough. And that is, nowadays, people used to use DTaP as a vaccine, but nowadays people are more commonly using vaccine because it is a more efficient vaccine. And then cures include antitoxins and antibodies, such as metronidazole, erythromycin, and procaine, penicillin G. In 1890 and 1891, immunization was discovered, and people began to become cured. Diagnosis include a throat swab specimen, skin lesion sample that is culturally grown. Patients are kept in isolation until they develop diphtheria-like symptoms. And then after antibiotics finish, after symptoms go away and finish using their antibiotics, patients are contagious until an additional 48 hours later. Experiment. Experiment was conducted by Kolibol and other scientists. Objective was to test the diphtheria toxin recreation with genetic engineering. Diphtheria is one of the deadliest protein toxins known to mankind, and different genomes allow for variety and for different mutations to develop. Using different types of these diphtheria toxins, proteins to create medicine and vaccines for diphtheria. Scientists took many genomes of diphtheria and attempted to split and change the genome and understand the structure behind diphtheria to further develop antitoxins just in case the diphtheria strand mutates. And on to conclusion. Diphtheria is an ancient and powerfully diverse bacterial protein toxin and is dated back to when Hippocrates recorded it in his journal. Corynebacterium diphtheria is the cause of diphtheria. Cures and vaccines for diphtheria are developed and discovered, and is similar respiratory disease to tetanus and pertussis. Nowadays, thankfully, due to vaccines and cure, diphtheria is now on the decline. Thank you.
Questions for Jeffrey?
What were the names of the swollen gray things on your neck?
What is it?
In your neck. What are the names of the swollen gray things on your neck?
Oh, it's not really a name, but it's a thick pseudomembrane layer. It's basically, yeah. Does that answer your question?
Yes.
Okay.
So for the symptoms, bull neck is one of the symptoms, correct?
Mhm.
Can that be fatal?
It could cause choking, and bull neck is also another name that is used for diphtheria. It could cause choking because it inflames the neck, and it could potentially block the airway. Does that answer your question?
Yes.
Chris?
What is malaise?
Malaise is basically, it's like chills and fever. It's really another synonym for chills and fever.
Jazz hands.